Good morning. This is Jkatz, Seniors Real Estate Specialist. I have the pleasure and honor today to introduce David Weisgerber. David, I'd like you to tell our viewers what your role is at the Livermore Senior Center.
Yeah, so I'm the community outreach supervisor. So I oversee our senior services programs, volunteers, and community outreach. So obviously things have changed a little bit here during the shelter-in-place order and all of that. So we've shifted our priorities a little bit and really focused on kind of, I would say, three main things, and that's connection with our seniors, education on the resources and all the resources that are available for folks and connecting them, and then health and wellness. And those, I would say, are our three priorities, kind of as how we've shifted over the last, I don't know, 6 months, I guess.
Yeah, that was my actual first question is how is the Livermore Senior Center specifically helping seniors during this challenging time?
Yeah, so like I said, a couple of different things. When the shelter-in-place order first went in, we have a lot of community partners that we work with, both be it the City of Livermore. So we're a special district, so we're the Livermore Area Recreation and Park District. So we work closely with the City of Livermore and then a bunch of our local nonprofits. So with that is Tri-Valley Haven Mobile Food Pantry, City Serve, Open Heart Kitchen, handful of things. So what the main program that has been going uninterrupted is our senior lunch program, and that's our partner Open Heart Kitchen. So that shifted from an in-person dining experience to curbside pickup. And with that, we're serving, I would say, almost 2,000 meals a month. So that's Monday through Friday, 12 to 1. And they do ask for a $3 suggested donation, but right now we're not doing any in-person donation. So if folks want to donate on the website, great. If not, no big deal. But that's a great resource, hot meal every single weekday. So that's kind of one piece of it. We're also working with our Tri-Valley Haven Mobile Food Pantry, delivering groceries to a handful of our senior living facilities. Actually, I'm doing that in about an hour. That's where I got to go after this. And then, as we're doing right now, we've shifted a bit to our virtual program. So we're offering Zumba classes virtually. There are a couple YouTube classes and tutorials and fun little videos that we've done. We've embraced the Zoom culture as we're doing right now. And then once the county allowed us to do, as I mentioned about health and wellness, outdoor fitness, that's been a huge thing for us. So we're running a host of outdoor fitness classes at a couple of different locations, but we're offering outdoor Zumba, outdoor Tai Chi, line dancing, light and easy aerobics. And so with that, we've of course put all of our safety protocols in place, and with social distancing, no shared equipment, but really that connection piece and the health and wellness piece is so critical. Because as you said, I mean, the seniors, it's a tough time for them, and obviously they're especially vulnerable right now, and so we're just doing what we can to kind of foster those connections and keep people doing at least the little sliver of normalcy that we can have. So we've got a bunch of different stuff going on, and I can get into a little bit more details as we go through, but that's kind of a brief overview of what we got going.
And I actually have been a witness to those Zumba classes and the drive-through food pickups through Open Heart Kitchen, because I live right behind the Livermore Senior Center.
Oh yeah.
So I personally witnessed the great work that your organization is doing during these really, really difficult times and helping the people. It brings up another question, David. Moving forward, do you see a need for additional services as a result of COVID-19?
Yeah, I mean, we're not going to know the long-term impacts of this for a while. And I think that the main thing is really just keeping ourselves knowledgeable about what's going on. So as I mentioned, we have a handful of nonprofit partners that we meet with regularly. Another really key one is Senior Support of the Tri-Valley. They're based over in Pleasant Hill. Yeah, they're a great organization. And so one of the values of staying super knowledgeable is when folks call us, we have the resources and we have the information. We know what's going on. We know what the opportunities are through senior support. We know what the opportunities are through, say, the Alzheimer's Association, through Meals on Wheels, all these different agencies that we meet with all the time. And so even if we don't have the exact thing that can help someone, because maybe we don't know what that is yet, we definitely are able to connect them with those different resources. So, I mean, to answer your question, I don't totally know what the long-term effects are, but there's going to be some, you know, and it's probably going to be a mental health component to it. It's probably going to be a feeling of isolation. And I think those are the things we're trying to be proactive to combat.
Challenging times, and I know that I talk to a lot of seniors and senior communities, and certainly organizations like yours and like the Senior Support Program of the Tri-Valley doing some amazing work to try to bring some sort of normalcy to this critical, you know, situation, the loneliness, the isolation. What are 2 or 3 of the most common things that people call the Livermore Senior Center for that they request?
Yeah, so I mean, a lot of folks are asking for information about transportation, of course, about housing. That's a big one, and you know, legal assistance, Medicare, that kind of thing. And so yeah, I mean, we just try to, as I mentioned, kind of point them in the right direction. We do work with legal assistance for seniors, and they are still taking, even though not in-person appointments, they're doing over-the-phone appointments for HICAP, which is help with medical insurance if you have questions about that. We have some transportation resources that we can connect folks with and give them information. And then housing's, of course, always the trickiest one, right? And it's really expensive and not all that available. So it's helpful to have folks like you and different resources around, but that's always going to be a tricky piece. So, you know, we try to connect them with folks that know more than we do, but at least we've got a couple phone numbers to refer.
You know, the housing question is very interesting because a lot of people may assume that seniors are well housed. Maybe they've been in their homes for 40, 50 years, and at least in that part of their lives are stable, but not necessarily the case. You're right, it's an expensive area to live in, and not everybody has a home, and not everybody can afford the average rent of, you know, $2,000, $2,500 for a 1-bedroom apartment. So you being able to direct seniors to maybe below market rent options or options for lower income senior housing, which there are in this area, is very, very valuable.
Yeah, absolutely. And not only that, but sometimes even if folks do have a home, but that doesn't work for them anymore because it's either too much maintenance or they need in-home help or they need assisted living, navigating those steps and giving people a place to start is also another thing that folks call about, because it's like, yeah, they have a home, but they don't even know where to start. They don't even know what the options are because they've lived in their home for a number of years, and that's another key question.
How do you